Hello there. So I remember while revising for my Part 2 exam, I had real difficulty remembering which drugs were contraindicated and during which phase of the pregnancy period. So whether it was allowed in the preconception, pregnancy, or the postpartum period. And I had a lot of difficulty looking this up. So I thought I'll take the summary tables from the different talk articles and present it in a more simplified manner to you so it helps with your exam revision. Right, so the first drug we are going to talk about is interferon B, and in preconception, the advice is to stop after conception. In pregnancy, it's contraindicated. In breastfeeding, it's contraindicated. And the comments are: does not cross the placental barrier, no increased risk of congenital abnormalities, spontaneous miscarriage, SGA, preterm delivery with early pregnancy exposure. Next drug is glatiramer acetate, which again is stop after conception, contraindicated in pregnancy, and to be used with caution in breastfeeding. Comments are: does not cross the placental barrier, no increased risk of congenital abnormalities, spontaneous miscarriage, SGA, preterm delivery with early pregnancy exposure. Next drug is natalizumab, which is the advice is stop before conception, maintain effective contraception for 2 to 3 additional months after discontinuing the drug. Although some women are able to discontinue treatment before or during pregnancy, others with more severe disease may elect to continue treatment. Contraindicated in breastfeeding. The comments are: crosses the placenta after second trimester and peaks during third trimester, increased risk of SGA fetus, no increased risk of spontaneous miscarriage, fetal malformations known to cause SGA fetus, fetal hematological abnormalities like anemia and thrombocytopenia. The other drug is steroids. The advice for preconception is for it to be possibly used in pregnancy, possibly used in breastfeeding, possibly used as well. Used to treat flare-ups, increased association with maternal hypertension, gestational diabetes, SGA infants, preterm rupture of membranes, preterm delivery, can cause neonatal adrenal suppression at higher doses, give stress dose at delivery. The next drug is Teriflunomide, which is stop before conception, recommend an accelerated elimination procedure with oral cholestyramine, maintain effective contraception as long as plasma concentration is above 0.02 milligrams per liter. Contraindicated in pregnancy and breastfeeding. Teratogenic in animal studies, but not in humans. No increased risk of spontaneous miscarriages. Next drug is alemtuzumab. Stop before conception. Maintain effective contraception for 4 months after discontinuation. Contraindicated in pregnancy and breastfeeding. Does not cross placental barrier until week 13. Embryo toxic in animal studies. No increased risk of spontaneous miscarriage or teratogenicity in human studies. Right, we now move on to the next table that we have here. The next drug is finglomide, which is stop before conception, maintain effective contraception for 2 months after discontinuation. In pregnancy and breastfeeding, it's contraindicated. So crosses the placenta barrier, teratogenic in animal studies, increased risk of spontaneous miscarriage, and higher rate of fetal abnormalities. The next drug is metoxantrone, which is stop before conception, maintain effective contraception for 6 months after discontinuation, contraindicated in pregnancy, contraindicated 28 days of breastfeeding is contraindicated, 28 days of clearance, reduction of ovarian reserve and amenorrhea, fetal growth restriction and preterm delivery in animal studies. Methotrexate, stop before conception, maintain effective contraception for 6 months after discontinuation, contraindicated both in pregnancy and breastfeeding, teratogenic and embryotoxic, increased miscarriage and congenital anomalies with specific pattern. The next drug is mycophenolate mofetil, stop before conception, maintain effective contraception for 6 weeks after discontinuation, contraindicated both in pregnancy and breastfeeding. It's teratogenic, increased miscarriage and congenital anomalies with specific pattern. The next drug is dimethyl fumarate, stop before conception. Contraception could be stopped rapidly as short half-life, contraindicated both in pregnancy and breastfeeding, crosses placenta barrier, no increased risk of miscarriage or fetal anomalies. The next drug is cladribine, which is stop before conception, maintain effective contraception for 6 months after discontinuation, contraindicated both in pregnancy and breastfeeding, very limited data, teratogenic in animal studies, no increased miscarriage rate, congenital malformation in humans. The next drug is ocrelizumab, stop before conception. Women of childbearing potential should use contraception while receiving treatment and for 6 months after the last infusion. Contraindicated in pregnancy, contraindicated in breastfeeding. Humanized monoclonal IgG antibody targeted against CD20 B cells, so crosses placenta barrier, very limited data. Is it too early to tell? Only approved by NICE this autumn with a warning against pregnancies. Right, we now move on to the next table, which continues, which talks about more of the same drugs. So the first drug that we have on this table is sulfasalazine and mesalazine, which is aminosalicylates. So used during pregnancy is possible, used during breastfeeding is also possible. Then metronidazole again can be used during pregnancy and breastfeeding. Steroids, we know that already, can be used during breastfeeding and pregnancy. Thioprines, which is azathioprine and mercaptopurine, possible used during pregnancy and possible during breastfeeding as well. We've got tacrolimus and cyclosporine, which is calcineurin inhibitors, both again possible to be used during pregnancy and breastfeeding. Biologics like infliximab and adalimumab is again possible to be used during pregnancy. Used during breastfeeding is unclear, but benefits are likely to outweigh the risks. Mycophenolate mofetil is to be avoided in the pregnancy and breastfeeding. Methotrexate is contraindicated in pregnancy and breastfeeding. Well, I hope those were useful for you because as said, when I was revising, it was very difficult for me to extract all that information and keep it in my head, basically, for the exam. So by having those summary slides, I hope they'll make it easier for your revision. Good luck.